Hello everyone, my name is Katie Lane and I'm with Truven Health Analytics. Truven Health is the education, training, and assistance contractor for the MACPro system. The purpose of today's webinar is to help you understand the roles and the responsibility of the roles in MACPro's Health Home State Plan Amendment submission, review, and disposition process. Additionally, by the end of this presentation, you will understand the next steps for getting ready to work on health home spas in MACPro. I'm going to put the call back on presentation mode now. There will be an opportunity to ask questions towards the end of this presentation.
Presentation mode is now enabled.
CMS training. CMS and training personnel are here to assist with any questions you may have at that time. Also, please note that we are recording this session for future reference, and the slides presented today will be provided via email. We have a full agenda for today. We'll start with a brief background on MACPro. Then we will discuss the rollout plan for MACPro Health Home State Plan Amendments, or SPAs, followed by details on the conversion from MMDL to MACPro, and an explanation of the MACPro Health Home SPA user roles and the workflows in which they are involved. The webinar will end with information about how to access MACPro, next steps, how to obtain technical assistance for using the system, and an opportunity to ask questions. Let's begin our webinar with a brief background on MACPro. MACPro, or the Medicaid and CHIP program, is a web-based system for the submission, review, disposition, and management of Medicaid and CHIP initiatives, such as state plan amendments and quality measurement reporting. For some applications, MACPro will be a new online submission tool. For others, it will be a change from what was once a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. In terms of health home state plan amendments, MACPro will eventually replace the Medicaid Model Data Lab, or MMDL, and the paper-based process of submitting and reviewing health home SPAs. MACPro is being implemented to improve the state reporting and federal review processes, program management, and transparency. Both CMS and states will know where a submission resides, when the CMS response is due, and the status of the review. Additionally, MACPro supports data-driven decision-making for Medicaid and CHIP programs. Let's talk about the Health Home SPA rollout plan. If you were involved with quality measures reporting, you may be familiar with MACPro already. It was launched in December of 2015 and contains the quality measure reporting for the Maternal and Infant Health Initiative, Health Home Quality Measures, Adult Quality Measures, and Child Quality Measures. Today's training will focus on the available roles in MACPro for Health Home SPA users. Future trainings will be offered on how to submit state plan amendments and CMS's review and approval processes. Health home SPAs previously approved in the Medicaid Model Data Lab will be converted into MACPro. The data in MMDL from approved health home SPAs will be copied into the MACPro Health Homes template for states to use as the basis for future amendments. States will find the MACPro screens pre-populated with the currently approved information, except where the MMDL and MACPro templates differ. Additionally, the official and complete copy of all health home SPAs approved in MMDL may be viewed in MACPro as PDFs. Health home SPAs currently being processed in MMDL will be completed in MMDL, and once the MACPro Health Homes application is operational, CMS will announce a date by which the last submissions can be made in MMDL. Finally, when subsequent SPAs are submitted and approved in MACPro, they become the official record of the health home program. Now we'll review the different health home SPA user roles within MACPro. The first step in preparing to work in MACPro is obtaining a MACPro role. Let's take a moment to discuss what you will learn in this section. We will cover which CMS Health Home Spa MACPro roles are available and what each role can do. Different roles have been established for CMS and states within the MACPro system. These MACPro roles determine to what capacity a user will employ MACPro. It's important to note that user roles in MACPro differ from those that are used in CMS's other web-based systems like MMDL, WMS, or CARTS. And MACPro Health Home Spa CMS roles differ from MACPro CMS quality measure roles. Additionally, Health Home Spa roles are organized so that you may have a primary role and a secondary role. Your primary MACPro Health Home Spa role determines what secondary MACPro Health Home Spa roles are available to you, and certain roles are specific for CMS Central Office, Regional Office, and state users. Finally, all roles must be filled for proper workflow functionality. First, let's review the Health Home Spa roles available to CMS. This page shows the MACPro user roles, and we will go into each role in detail in the following slides. You'll notice that there are 3 roles in bold. These are the 3 central roles within the CMS workflows, including the CMS point of contact, the submission review team, and CMS senior management. The CMS point of contact, or CPOC, is the person responsible for the review process and ongoing communication with the state regarding a submission. The submission review team, or SRT role, is for individuals identified to review reviewable units within a specific submission. Reviewable units are essentially sections of a submission package, such as health home, payment methodologies, or health home service providers. Future trainings will go into reviewable units in further detail. The person with a CMS senior management or senior manager role reviews the submission and the approval or disapproval recommendation. Additionally, an individual may have more than one role in MACPro. There are specific roles that are available to be held concurrently, depending on your primary role in MACPro. Like I mentioned before, it is important to remember that all CMS roles must be filled for proper workflow functionality. Let's take a moment to review some of the responsibilities of the CMS user roles. The CMS System Administrator is an administrative role that can approve MACPro role requests for users, reassign CMS tasks, and disassociate users from roles. Users with this role may not hold any other MACPro role, and please note that there may be role-related activities on this list that the CMS System Administrator may not be able to do initially, but will further down the road. The CMS Package Disapprover can disapprove packages. CMS Package Disapprovers cannot hold any secondary roles in MACPro, and this role is for Central Office users. The Office of Strategic Operations and Regulatory Affairs, or OSORA role, can coordinate communication for the disapproval process between CMS offices and informs the CPOC and POC admin upon package clearance and documentation completion. The OSORA cannot hold any secondary roles in MACPro. The CMS Senior Management role can evaluate the recommended disposition provided by the CMS point of contact and reviews the recommended disposition of disapprovals and the disapproval justification. Primary senior manager roles can simultaneously hold the secondary roles of CMS package approver, CMS point of contact, submission review team, subject matter expert, or subscriber. You could think of the CMS senior management role as a senior reviewer role. The CMS package approver role can approve SPA packages. This role is recommended for central office users for the P1 and P2 SPAs and regional office users for P3 SPAs. Primary CMS package approver roles can simultaneously hold the secondary roles of CMS point of contact, submission review team, subject matter expert, or subscriber. The Submission Review Team Administrator, or SRT admin role, can approve SRT and SME role requests, reassign SRT tasks, and view staff workloads. Primary SRT admin roles can concurrently hold CMS Point of Contact admin, CMS Point of Contact, and subscriber roles. Please note that there may be role-related activities on this list that the SRT admin may not be able to do initially, but will further down the road. The Point of Contact Administrator, or POC admin role, can oversee the official submission package through the CMS Senior Management Review process for disapprovals, tailor disapproval letters to states, approve CPOC and SME role requests, and reassign CPOC tasks. Primary POC admin roles can concurrently hold CMS Submission Review Team admin, Submission Review Team, and subscriber secondary roles. The Subject Matter Expert, or SME role, can provide and maintain internal policy notes and provide SME input to the review team upon request through an offline process. Primary SME, or Subject Matter Expert roles, can simultaneously hold the secondary roles of Submission Review Team, CMS Point of Contact, and subscriber. For each submission, there is a submission review team made up of the submission review team members and the CPOC. Each member of the SRT receives a review assignment and reviews and submits comments about the submission using the review tool within MACPro. The feedback provided by the SRT members, or submission review team members, is used by the CMS Point of Contact to recommend approval, disapproval, request an REI, or to request a clarification. The submission review team role can receive package review assignments, provide section assessments throughout the review tool, reviews and submits notes and comments to official and draft submissions, and provides recommendations for REI, approval, and/or disapproval. Primary SRT roles can simultaneously hold the secondary roles of Subject Matter Expert, CMS Point of Contact, and/or subscriber. The CMS Point of Contact, or CPOC, is the primary liaison with the state for a particular submission and coordinates the review process. The CPOC role can oversee the review of official and draft submissions, maintains the composition of the review team, as in they select review team members within MACPro, documents and reviews correspondence log entries, reviews team feedback within the review tool, recommends a disposition for a submission package, requests clarification and initiates a request for additional information from the state, tailors approval notice to the state, sets and manages internal milestones for SRT members and senior managers, and oversees a submission package through the CMS Senior Management Review process for recommended approvals. Primary CPOC roles can simultaneously hold the secondary roles of Submission Review Team, Subject Matter Expert, and/or subscriber. The CPOC roles will be filled by regional office users, and they may choose to be CPOCs for specific states within their program and authority. As a secondary role, they may also be the CPOC for another state. The Report Administrator role can view reports and submission packages on behalf of CMS Review Team administrators, such as the POC admin or SRT admin. Report administrators cannot hold any other roles in MACPro. And the Subscriber role subscribes to information for specific states of interest and can view information in a read-only format. CMS users may choose to be subscribers for specific states within a program and authority. Like the report admin, primary subscriber roles cannot hold any secondary roles in MACPro. So now let's look at how these roles operate in the review process. First, we'll take a moment to discuss what you will learn in this section. We will cover generally how a SPA is reviewed by CMS. Additionally, we will further describe which roles are involved in the approval and disapproval process flows in MACPro. So here is a full CMS SPA approval workflow. Right now, this may be a lot to take in. We will break it down step by step in the following slides. However, as you become more familiar with MACPro, I suggest keeping this slide in mind for your future reference. There will be future trainings that walk through these steps within the MACPro system. So first, the state submits the official SPA submission package to CMS. Then, the CMS point of contact, or CPOC, receives the submission package. The CPOC selects submission review team members for each reviewable unit or section of the SPA submission package and sets a milestone date for their completion of their assessment within the review tool. The milestone date is essentially an internal due date to ensure the review stays within the 90-day clock. If during review there are some quick questions and potential quick revisions that need to be done by the state, a clarification may be done returning the package to the state. A clarification is what you may know now as an unlock in MMDL. We will go into these steps in detail in a few slides. Once the review of the submission is complete, the CPOC provides a recommended disposition within MACPro. The CPOC may recommend a request for additional information, or RAI, based on the review of the package. This will return the package to the state with specific questions and stop the 90-day policy clock. We will go into this process in more detail in a few slides. The CPOC may also recommend disapproval, and this alters the workflow. We will review the disapproval workflow in a few slides as well. If the CPOC recommends approval, he or she will then draft the approval notice and select senior management roles to review the package. Senior management then reviews the package disposition recommendation and has the option to request a meeting or disagree with the recommendation. Senior management then reviews the package disposition, and we will assume that senior management agrees with the recommended approval. In some instances, the CPOC may bypass outstanding senior management responses in order to keep with the 90-day clock. Next, the package approver receives the package. He or she has the option to request a meeting. The package approver does not have the option in MACPro to disagree with the recommended approval. Once the package approver agrees with the approval, the CPOC receives the package, uploads the PDF approval letter, and returns the package to the state point of contact. The SPOC receives the package and acknowledges receipt. Finally, the CPOC closes the package in MACPro. So here is the full CMS workflow again. As you can see, we reviewed in detail the top and bottom halves in the previous slides. Next, we're going to review in detail the clarification process. First, the CMS point of contact writes questions to the state in the correspondence log related to the clarification request. Then, the CMS point of contact initiates the clarification and returns a submission package to the state. The state point of contact receives the package in their task list and notice that the correspondence log was updated. The state point of contact then reads the correspondence log message from CMS. And at this point, the state point of contact determines if the package needs to be updated. If so, the state point of contact responds to the CMS point of contact in the correspondence log accordingly and updates the package. If not, the state point of contact responds to the questions in the correspondence log and does not modify the package. Once the clarification questions are resolved, the state point of contact returns the submission package to CMS for continued review. As a reminder, the clarification process does not stop the 90-day policy clock. And now we will go over the RAI process in more detail. The CMS point of contact and/or the submission review team recommend RAI within the review tool. Then, the CMS point of contact takes action on the package and initiates RAI. The CMS point of contact completes the RAI form and returns the submission package to the state. As a quick note here, the REI form will be replacing the REI letter that was typically sent to states. Then, the state point of contact receives the submission package and REI form and their to-do list. At this point, the state point of contact determines if the package needs to be updated based on the information asked in the REI form. If so, the state point of contact modifies the package accordingly and responds to the questions within the REI form. If not, the state point of contact responds to the questions in the REI form and does not modify the package. Once the REI form and any modifications to the submission package are complete, the state point of contact returns the submission package and REI form to CMS. A new 90-day clock begins at that point. Now let's take a look at how the process flow would differ in the case of a disapproval. Like with the approval flow, we will break down this disapproval flow into two parts, beginning with the upper portion of the workflow. Much of the process is the same in the beginning stages of the disapproval workflow compared to the approval flow. We will start with the point at which the CPOC determines that they will recommend disapproval. At this point, the POC admin completes the disapproval package and selects senior management users to review the package and the disapproval recommendation. Then, senior management reviews the package and recommended disposition. The senior management user may request a meeting, or the senior management user may disagree with the recommendation, which returns the package to the CPOC for the submission review team to review. Again, senior management reviews the package. Let's assume that senior management agrees with the disapproval. The package disapprover then receives the package. The package disapprover may request a meeting, and once the package disapprover agrees with the disapproval, the OSORA receives the package and coordinates with external stakeholders. The package disapprover then disapproves the package, and once the package is disapproved, the CPOC receives the package, uploads the PDF disapproval letter, and returns the package to the SPOC. The SPOC receives the package and acknowledges the receipt, and finally the CPOC closes the package. So let's now review the state MACPro Health Home SPA roles. In this section, we will cover generally who is involved when a state creates and submits a SPA. This page lists MACPro's Health Home SPA state user roles. A state user may have more than one role in MACPro with one exception. The state system administrator can only hold the state system administrator role. It is important to note that like CMS, all state roles must be filled for proper workflow functionality. So let's go over the 4 state roles in detail. The state editor is responsible for creating state plan amendment submission packages, and state editors can simultaneously hold the role of state point of contact and state director. The state point of contact, or SPOC, is the next person in the process. The SPOC role is responsible for reviewing and submitting the SPA submission to CMS, responds to requests for additional information or REIs from CMS, and documents and reviews the correspondence log. SPOCs can also hold the roles of state editor and state director. The state director is the third step in the state SPA submission process. The state director role reviews and certifies submission packages. The state director can also hold the role of state editor and state point of contact. The state system administrator is an administrative role that can create and maintain a state profile, which must be completed before any SPAs are created within the state. They also can approve state role requests, and please note that this will not be the case for the initial rollout of the health home SPAs. Additionally, they can reassign state tasks and disassociate users from roles. State system administrators can only hold the state system administrator role, and the role must be filled in order for the state users to request their roles. Next, we will review the state submission process flow. In this section, we will cover generally how a state creates and submits a SPA and who from the state is involved in the process. Here is the full state SPA submission workflow. Let's walk through these steps for the process. First, the state editor creates the SPA submission package and completes and validates the reviewable units. Then, the state editor sends the package to the state point of contact, or SPOC, for review. The state point of contact reviews the package and includes any needed updates. The state point of contact may return the package to the state editor for further edits if needed. If not, the state point of contact forwards to the state director for review and certification. The state director then reviews the package, but they cannot edit the information. If edits are needed, the state director may return the package to the state point of contact. Assuming the state director certifies, the package is sent to the state point of contact for submission to CMS. The state point of contact then can submit the package. However, if they notice changes are needed, they may select to edit the package and resend it for certification by the state director. There will be a state-focused in-system demonstration that will review each of these steps in further detail in future training. Let's now review how you will obtain access to MACPro. Managers have been working to identify who should hold which MACPro roles. Reach out to your manager to make sure your role was identified on a CMS MACPro roles template. Then a single MACPro roles template for your team with all information will be sent to the MACPro help desk for processing. Managers should keep in mind while filling out the roles template which roles can be held together. There are certain MACPro roles that cannot be held with others. Additionally, certain MACPro roles are specified to be in central office, the regional office, or assigned to specific states. As we mentioned previously, certain roles are responsible for approving other roles. This hierarchy indicates which roles are approved by whom. As you can see, the CMS System Administrator approves the majority of CMS roles, and the CMS SRT Admin and POC Admin roles may approve a few others. For the initial rollout of the Health Home Spa Authority, this approval hierarchy will not be used as MACPro roles will be assigned and mapped to accounts manually. However, keep in mind for the future when user management functionality is released. Technical assistance will be available to all MACPro users. For issues related to MACPro access and how to use the MACPro system, contact the MACPro help desk at macpro_helpdesk@cms.hhs.gov or call 301-547-4688. To help expedite an answer to your request, here's the information that should be provided in an email request to the help desk. Your contact information, the application you are using. In this case, you might want to indicate that you're using MACPro for Health Home State Plan amendments. Give a detailed description of the problem, including how many people are being affected by it. Specify the last screen or activity that was performed before experiencing the issue, and include the error message that appeared, and preferably a screenshot. Here's a reminder of your next steps. Management within your center or group will return the MACPro roles template with their team's information to the MACPro help desk at macpro_helpdesk@cms.hhs.gov. In-system demonstrations will be conducted that will provide you a first-hand look at how health home spas will be created, submitted, and dispositioned in MACPro. There will be 2 demonstrations, one focusing on state actions and another focusing on CMS. You will receive notifications including your MACPro information once the roles templates are processed, And finally, look out for the MACPro Health Home Spa release announcement. And now we have time for some questions. So I'm going to take it off presentation mode.